Hello, everyone, and thank you for joining us once again. We are at day 2 of the American Society of Reproductive Medicine Conference here in San Antonio. And once again, we are going to be broadcasting these Facebook Live interviews from the EVRMA Global booth here on the conference floor. And lots of research is being presented here at the conference. This group has some 42 research papers that they are presenting. And joining me now to talk about one of them is Dr. Jason Franasiak and Dr. Linnea Goodman. Thank you so much for spending some time with us this morning.
Thanks. It's my pleasure.
So one of the things that you guys were looking at in the research that you've done is PGS testing. So before we get into the specifics of the study that you're presenting, tell us what PGS testing is.
Well, PGS testing is an ability for us to, before we place embryos back into the uterus, determine whether or not they have the right amount of chromosomes or the DNA material that makes all of us who we are. So that's very important because it turns out that not having the correct amount of DNA is the number one cause for failed pregnancies or ongoing abnormal pregnancies, which may result in a miscarriage.
So PGS testing, meaning pre-implantation genetic screening. So as you said, it's before you are implanting, then explain it.
Sure. Go right ahead, Dr. Goodman.
You know all the terminology.
Absolutely. And so when couples are going through infertility treatment and they need in vitro fertilization, we take the egg, we take the sperm, we put them together, we grow them into a blastocyst, which is about 5 days. And at that point, we can actually take a small biopsy of the outer cells that end up being the placenta and get the genetic material of that embryo and to see if it's normal or abnormal. And our normal embryos are the ones we want to put back in to have the highest chance of a life.
So those are the ones then that you would decide which one you want to transfer from there.
Absolutely.
And hopefully the single embryo transfer is the goal. So tell me about the study that you're talking about here today regarding PGS testing.
Absolutely. So this is an interim analysis of our data for the randomized controlled trial for PGS utilization in low responders. So this is a very unique and novel study. There has not been a study done to date which has looked at low responders based upon their risk for low response. So we look at patients who are at risk for low response based upon counting the number of resting follicles that they have or on a blood test called AMH or anti-Mullerian hormone. And once they have screened into this study, we will choose to randomize them to either having PGS or not having PGS, and then the remainder of their care will be routine. Our hope is to be able to look at whether or not PGS testing in those that are at risk for low response has the opportunity to decrease the time to pregnancy and maybe has the secondary benefit of decreasing the risk of miscarriage.
And so you've conducted this study, and what did you find?
So we're at a kind of an interim analysis,
okay.
So kind of a halfway point for the study. And we wanted to do a safety analysis of the data that we have to date. The data did show, in fact, that the group that was randomized to the PGS had a shorter time to pregnancy, and although it wasn't statistically significant, did have a much lower miscarriage rate.
Why do you think that is? Why do you think it's shortened the amount of time?
When you have a certain number of embryos, the goal is to put back a normal embryo. Say we get 3 or 4 embryos, and a few of those are abnormal. When you go through that transfer, you then would have either a negative pregnancy test or a chance of miscarriage. And so if you can screen those out ahead of time, you can get to that pregnancy much faster that way.
What happens if someone goes through all this testing? Let's say you have 4 embryos and then none of them really meet that perfect marker that you're looking for. Do you just do it again, or?
So that's why the time to pregnancy is important. If you go through a cycle and have all abnormal embryos or all aneuploid embryos, then you wouldn't transfer any of those embryos, and you can make that decision whether or not to go forward with a second cycle or to go on to a different option, such as egg donation.
So what does this mean for your patients?
I think that it potentially means a great deal for the patients. And number one, time is one of the most precious commodities when it comes to fertility care. Unfortunately, as it turns out, time is oftentimes both the fertility doctors and the fertility patient's enemy. And so we're oftentimes trying to decrease the amount of time from the point of entry to the point of exit with a live birth. So it is very important for patients who end up being able to go through treatment more quickly and have successful outcomes. I think the subsequent thing is the potential decrease in miscarriage is a big deal.
Yes.
So when patients go through miscarriages, that is very clearly emotionally quite trying. The second thing is that physically, it can be quite challenging, particularly if you have ongoing abnormal pregnancies. These ongoing abnormal pregnancies oftentimes will end up requiring surgical intervention for these patients. And in fact, in this particular trial, we quite sadly, in our control group, the group that did not have the PGS testing, had an ongoing trisomy 18 and trisomy 21 pregnancy, which required a second trimester procedure. And these procedures can be quite concerning and dangerous for patients. We want to avoid those if we can at all costs.
So are we saying then that by doing this testing, perchance, in the in this low responsive group, you're raising their chances of having a healthy birth because you're able to then screen these embryos before transfer?
I think that's what our hope is for our PGS screening in all populations. This is really dedicated to those patients that may not have many embryos. The thought is, if you don't have many embryos, why should you screen? Because if you only have 2 and you're putting back in 2, then do you need to screen? We're finding that this is very important for this population because we're able to move on to that next step when we need to move on.
And it means less frequent, hopefully you don't have to then go through multiple cycles if you're able to find the best embryo the first time around or the second time around.
If we're able to find the best embryo, it may decrease the chance of having to go through multiple cycles. The other thing that it does do is it avoids what we would kind of term to be futile transfers. That is, transferring an embryo that ultimately doesn't have the chance of producing a healthy baby. And so that transfer takes time. And again, time is concerning for fertility doctors and fertility patients.
Is there anything else that you've come across here at the convention that has really got you very excited about the future of reproductive medicine?
Absolutely. I think that there's been a couple of really fantastic presentations. One of our just graduated fellows, Dr. Caroline Juneau, presented what turned out to be an award-winning presentation looking at immunology in pregnancy, one of the largest trials looking at celiac disease. Really, truly spectacular, and she ended up, as I had mentioned, winning an award for that study. We have others that are presenting here on everything from innovations in PGS testing and next-generation sequencing to nanosomes, and we're really looking for the next thing to be able to help our patients and improve their outcomes.
I mean, it definitely seems like a field that is advancing at a very rapid pace. So many changes and so many scientific discoveries all the time.
And it's just, this meeting is so great because it's really a meeting of the minds. We come across all of our colleagues across the country, across the world, and really get to share ideas and see what's different and how we can improve our practice.
All right, well, Dr. Goodman and Dr. Franasiak, thank you so much for spending a few minutes with us. And again, we're going to be bringing these Facebook Live conversations throughout the day today here at the conference, and so please continue to check back the Facebook page and join us then. Thank you so much.
Thank you.
Thank you.